Now, we continue along this vein of the impact of COVID-19, but this time we talk about a different issue. So it's usually measured in rates of infection, deaths, jobs lost, and how it hit the national economies. But there's another metric, the surge in extreme poverty, that describes the most severe effect on the pandemic on the people of Africa. While recession, infections, and hospitals dominate the current daily headlines, the personal economic consequences of the virus are what will linger. A recently conducted study has been undertaken to estimate just how closely health was related to income in the context of COVID-19. It found that poor populations bore a disproportionately higher burden of poor health. A remarkable finding was that the income-related health inequality in COVID-19 period was about 6 times that obtained in 2017. This shows that income had a much stronger relationship with health during the COVID-19 crisis than before. We're joined now by Dr. Chijioke Nwosu, who is the Senior Research Specialist at the Human Sciences Research Council. A very good evening to you, and thank you so much for speaking to us. Just talk to us how you measured inequalities and how it was related to health. What studies did you undertake and how were you framing it?
Good evening to Pisa, and welcome to your viewers. Yes, so as you rightly said, a very important aspect of a pandemic like this is to see how it's really affected, the well-being of people across different levels on the socioeconomic spectrum. So what we did was we used a statistical measure called the concentration index, which basically ranks people across a population like South Africa across their income, and then looks at a measure of interest, in this case, health. And the whole idea, the whole essence is to see, which part of the distribution is affected to what extent, in terms of their health. So rightly, as you said in your introduction, what we did find was that, yes, even before the COVID period around 2017 and during the COVID period lockdown, poor health, was more concentrated on the poorer sections of the population. That is not really surprising and, unfortunate as it is, right? But of course, the dramatic result being that compared to before the COVID pandemic, the lockdown, and during the, COVID pandemic, we had this widening of the concentration of ill health, of poor health on the poor by up to 6 times, which is really remarkable and unfortunate.
So were there key factors that predicted the observed income-related health inequalities?
So the key factors that were statistically significant in this relationship were hunger, being hungry, not being able to afford enough food to eat. Another was race. Another was also, when you talk about, of course, the income inequality itself, because income inequality has a devastating impact on health and to an extent also employment. And of course, these results are not really, unexpected in the sense that you can imagine if a household doesn't have enough to eat, doesn't have food available, and they will not be able to purchase enough calories, to keep them going, to keep them healthy. And that can adversely affect health outcomes. And even things like race, when you see some racial groups, especially Black Africans, reporting higher probabilities of being sick and also being more likely to be poor. So all these interact to really bring out this.
Let's zero in on that. In a country like South Africa and the political history that it has, I mean, it would seem obvious that race would affect inequalities. But because we're talking about a scientific study and you had already started alluding to it, so explain to us, how does race predetermine how you're going to be affected by COVID-19 and income health related issues?
Yeah. So in this kind of model, there are 2 pathways through which a particular variable can significantly affect the outcome of interest, in this case, health. So a variable like health, the 2 pathways through which it adversely contributed to socioeconomic inequalities in health are through, unfortunately, Africans, of course, we use what we call, a benchmark category. Africans relative to whites were more likely to report being sick, in the survey. And also the second mechanism is that Africans were more likely to be found among the poor. So you see these two things moving, where a particular group is more likely to be poor and also more likely to report being sick. And then both of them now contribute, to making this particular group being worse off in terms of, when you're looking at income-related health inequalities. And frankly, yes, so maybe just come in here because I think you're gonna
So I'm wondering here, because there's already an understood definition of poverty, and there is a goal of eliminating extreme poverty by 2030. Given the advent of COVID-19, and it's been made clear to us that we don't even know what the long-term effects are, should we be redefining poverty? Should we be relooking at the goals that we have set in eliminating extreme poverty?
Yeah, I mean, that's a very important question, and it's really a question that that needs to take a lot of things into account, and the policymakers, I believe, will be grappling over time. I mean, I was recently somebody just published an article in terms of even whether the poverty lines that do exist, like the international poverty lines determined by the World Bank and other international development institutions, really make sense. So the whole idea of who is actually poor, it's a very complicated and complex issue. And I think that going forward, especially when we are talking about COVID-19, which has resulted in a massive hemorrhage of jobs, which has, displaced a lot of livelihoods. It's really a very important question to put out on the table to determine, to start talking about how do we even measure poverty? What does it really mean to have a dignified and decent livelihood?
Dr. Nwosu, that's a conversation I hope that we pick up in greater detail on another occasion. Thank you so much, though, for speaking to us and sharing the insights of your study. Dr. Chijioke Nwosu is a senior research specialist at the Human Sciences Research Council.